All right, I'm going to check my physician's orders, and the physician wants me to insert an IV in my patient to run maintenance fluids. So I'm going to enter the room, introduce myself. Good morning, my name is Brooke. I'm going to be your nurse today. I'm going to insert an IV into your arm, into your hand, just to run maintenance fluids because the doctor wants to make sure you're hydrated. So I'm going to perform hand hygiene. Then I'm going to verify the name and date of birth of my patient with their armband and make sure it matches. I'm going to ask my patient if they have any allergies to latex or antiseptics or adhesive tape, and my patient does not, so I can go ahead and make sure that they're comfortable, that I'm comfortable. I'm going to select the vein that I'm going to use, so I feel this one right here is really straight, and I think it's going to be good for an IV, so I can put a towel underneath my patient's hand, shave the area if it's hairy, and then I can gather my supplies that I need. So I have my start kit. I'm gonna go ahead and take my tourniquet out, and I would apply the tourniquet 15 to 20 centimeters above the site that I would be placing the IV. So it's gonna be a little bit lower on this one since it's just a hand, but so I'm gonna go ahead and tie off my tourniquet. Make sure it's nice and tight. And if the vein isn't dilated enough, I would have the patient dangle their arm and make a fist so that I can see the vein better. But this one, it looks pretty good. So then I can go ahead and put my gloves on. These are clean gloves. Okay, and I'm gonna clean the site. So I'm gonna take this out and pop it, and then I'm gonna scrub the site for 30 seconds to make sure it's really clean. And while it's drying, I can take my extension and my flush, and I'm gonna go ahead and flush this so that there's no air in it before I insert the IV. Okay, that's good. And I'm gonna make sure that this is clean where I set it down. And I'm gonna get all the rest of my supplies ready. So I have my Tegaderm gauze, tape, and I have my IV catheter. So now that my site is dry, I can insert the IV. So I'm gonna do this with the bevel side up. I'm gonna insert it at a 15 to 30 degree angle. And once I get in the vein, I'm gonna advance it, and I'm gonna get blood into the chamber. I know I'm in the vein, so I can advance it all the way until there's no more of the catheter showing. And then once I'm there, I can go ahead and remove my tourniquet. And I'm gonna apply pressure right above the site of the insertion, and I can remove the needle, and I'm going to put that into the sharps container, and then I can grab my my extension and secure that while I'm still holding pressure. And then I'm going to flush it just to make sure that there's no burning or anything, and my patient I would let go of the pressure there and flush it. My patient isn't complaining of any burning of any kind, so I can disconnect this. And I'm going to go ahead and connect this to the tubing that the maintenance fluid is running. And then I secure with the Tegaderm. So I'm going to go ahead and do this. I don't know if I think I probably did it wrong. I think it's upside down, but I secure that with a Tegaderm, and then I would go ahead and secure this tubing with some tape to make sure it's not in the way of the patient. And on the Tegaderm, I'm gonna go ahead and include the date and time and my initials and the gauge that I used. And I'm gonna make sure that my patient is comfortable and I can dispose of all of my supplies. and make sure that the infusion pump is running at the right rate. And then I'm going to document everything that I did, including date and time, my name, my patient's, how they handled the procedure. I'm going to include the dressing that I used, any solution that's running through it, and any teaching I had to give the patient. And then if I were to remove the IV, I would make sure I stopped the infusion, and I would disconnect the tubing from the extension. I would make sure my hands are clean, apply new gloves, and then I would peel the tegaderm up. And then I would get my gauze and my Band-Aid ready, and I would be applying pressure right here with the gauze, and I'd remove the catheter. I would put this into the sharps. I'd have my gauze and my Band-Aid and document everything, make sure the patient's comfortable.